My name's Jillian Blanco, and I would love to take 3 minutes of your time to talk to you about a policy proposal called the PrEP Access and Protections Act. I've been a registered nurse for 8 years, and I'm currently a third-year student in Gonzaga University's Doctorate of Nursing Practice Family Nurse Practitioner program. As a doctoral student, I've been researching and developing this proposal to improve PrEP awareness, access, and uptake. PrEP stands for pre-exposure prophylaxis, and it is an antiretroviral medication used to prevent the transmission of HIV in at-risk populations. It's between 92 and 100% effective and has been given an A rating by the U.S. Preventative Services Task Force. Currently, the only two medications available are Advocacy and Truvada, both of which are made by Gilead Sciences, and neither of them are available in generic forms. Unfortunately, this medication is underused in part due to a lack of provider knowledge and a lack of public awareness. The CDC has actually reported that 1 in 4 providers are unfamiliar with PrEP. The second big driver of poor uptake is the incredibly high cost, not only of the medication, but also of the required follow-up care and testing. Truvada has an annual retail cost of $20,000 and Descovy of $23,000 annually. Understandably, these costs make the medication out of reach for many of the people who need it most. Other contributing factors of poor uptake are inadequate insurance coverage or lack thereof entirely, patient or provider discomfort, and social stigmas. HIV continues to impact people in Washington state. In 2018 alone, there were 402 new cases of HIV and 193 new cases of AIDS. There are more than 1 million people in the U.S. eligible for PrEP, and yet only 1 in 4 are taking it. My proposed bill fills in many of the gaps that exist in current legislation. This proposal accomplishes this by expanding insurance coverage of PrEP and PrEP-related care without cost sharing or prior authorization. It would allow both pre- and post-exposure prophylaxis to be prescribed by pharmacists. Another way this bill expands PrEP access and coverage is by expanding telehealth. This could be modeled after the very successful initiative out of Iowa called TelePrep. Historically, expanding telehealth has dramatically reduced healthcare costs while also expanding access to care. This proposal would also provide $60 million in grant funding for the first 3 years. This could be used for educational programs, outreach activities, screening, follow-up care, prescriptive costs, and patient counseling. This proposal would reduce long-term healthcare costs. Additional provisions of this bill include extensive legal anti-discriminatory protections to those either taking or qualifying for PrEP, and it would also ensure that as new therapies become available, they will be fully covered as well. As a future NP, I will be an advocate and a stakeholder of this bill, and I can hope that you will be as well. Thank you so much for your time and consideration. Bye.